Welcome back, everyone. In this video, I wanted to outline power dynamics. I go over what I call, and I've read philosophical arguments by anarchists from other areas. They seem to contest with this or contend with it. But I'll give you a definition of classical anarchism, which is different than radical anarchism. Ultimately, I am talking about power dynamics because there's a power dynamic at play here that does not make sense. In this, I will address equal power dynamics, which would fall in the line of classical anarchism and even radical anarchism to some degree and level and extent. A bottom-up power dynamic is more indicative of a socialist or democratic or republic. That is a bottom-up power dynamic. But the dangerous ones are the ones that are top-down power dynamics. These are power dynamics that we find in oligarchies, in aristocracies, in theocracies, in monarchies, dictatorships. Pay attention through the video and through what I have to say. I will have more coming. There's a reason for this video. This particular one will be followed by another video where I talk about more in depth as to certain things that are going on within the health world. And I know people are mad at Big Pharma, but really I think that the big problem, the one thing that people should be focused on predominantly and utterly pissed about, is that of the insurance companies themselves. So you will find out why, and like I said later, I will be making and working on another video explaining what the insurance companies are doing and what fear, hype, and paranoia perpetuated by propaganda is doing to healthcare in our world. Maybe I've got a good point, maybe I don't. I'm only putting this out there so that you can decide.
So here we are, equal power dynamics, the road to classical anarchism. First of all, why am I even talking about this? This type of philosophy goes beyond that of even politics, yet still there are many political ideas in this world that affect power dynamics as well as raise ethical questions. The definition that I will be using for classical anarchism will be that it is the idea that no one person, empire, or organization should hold absolute power or dominance over a single individual. The definition that most people use, in my opinion, for anarchism is that which I would call radical anarchism, which is total chaos. Another thing to consider in both definitions, they allow for the absence of government, but not the absence of society. Radical anarchism has a harder time doing this than that of classical. Classical anarchism, with the definition that I am using for it, does not condemn nor condone capitalism, whereas under radical anarchism, one would be hard-pressed to keep capitalism. As I move forward into this discussion, please keep in mind, this is the way I am using the terminology between classical anarchism and radical anarchism. I feel it necessary to provide an example of classical anarchism in capitalism working in action. So, the idea is an equal power dynamic. This can still be achieved under classical anarchism, but we will need to adjust some laws and some regulations. Let's say that you work for Company X, and Company X is a really big multi-conglomerate corporation with a lot of power. Under the current system, Company X has the ability to ignore certain laws, regulations, and restrictions that are in place to protect citizens and the rest of society from Company X imposing its will on others against their own will to keep Company X from performing what society deems as unethical treatment towards the society and individuals. To put it more mildly, Company X is seemingly above the law and due process and does not have to comply with any measure of accountability for any unethical actions taken by Company X. This goes against the equal power dynamic of classical anarchists' stance. The radical anarchism, either this would be a dictator to rise to power or one to be silenced before it got through, or before it got enough power to become a dictator. And that would be under radical anarchism. Let's use the same hypothetical to consider how it should work under classical anarchist philosophy. Let's say Company X has just ran you, an individual, over as forth of not appropriately paying the agreed upon wages, i.e. slave labor. Entices and engages in physical abuse of employees or other gross negligence that cause personal and systemic problems to society and or the employee or individual that the society has agreed are unethical behaviors. Under classical anarchism, Company X would be held accountable by the individual or society, the same way any other offender would be. There would be no need for a lawyer. The individual or society would be able to investigate, hold a trial, and determine guilty or non-guilty in a court of law. This would mean that the employee, the individual, has the same power in legality or law as the corporation does. Under classical anarchism, there is no lighter sentence due to wealth. There is no get out of jail because of accumulated wealth. There is no extra legal power granted due to accumulated wealth, such as influencing laws or loopholes to get out of accountability for the company's actions or lack of ethical decision making. To dumb it down, under classical anarchism, there is no such thing as rich and famous privilege when it comes to legalities. So where does capitalism come in? It's really very simple. As forth as accumulating wealth, they get nicer and fancier things that they can and have the right to claim as their own property. Capitalism can still be used as a system of monetary exchange and value for certain services and material possession, but does not grant one privilege or power over law, order, and due process. Under classical anarchism, there is a lot of independency, and with that comes a lot of personal accountability. Want to use illicit drugs? That's fine. But if you do something stupid, like drive drunk and crash your vehicle, you as the individual are accountable, not the drug. The drug didn't do it. As it was your individual choice to take said drug, this is an equal power dynamic in that no organization, religion, or individual has absolute power or authority over another individual. We are all on the same page.
This is where I take a moment to tell you the story of someone who wanted to create a remote control device for men to abort unwanted pregnancies. And my argument to that was extremely authoritarian. This absolutely has to do with unequal power dynamics. See, as like the male would have absolute control as to whether or not the pregnancy would take place or not, that's a lot of authoritarianism over the female in that particular situation. What I proposed instead is that the male should have the ability to control whether or not the semen or sperm would be active or not. This gives both the female and the male the opportunity to control whether or not they are going to have a child or not. There's already a lot of medications out there, things for women to keep them from becoming pregnant. There's vasectomies. Vasectomies can be undone, but relatively not easy. It's a surgery both ways. They have been working on male birth control pills, but I don't think they're quite where they want them to be yet to be released. But the idea behind this is to give an equal power dynamic, because you don't want all the power in the hands of the male, but you don't want all the power in the hands of the female either, because there are females out there that will try and get pregnant by a man so that they can lock him in, so to say. There are accidental pregnancies where the woman does want to keep the child, which she has bodily autonomy to say, yes, I'm going to keep the child, and there's not much that the male can do about it. Having a remote control that aborts it, though, without the female's consent, though, is beyond authoritarian and cruel and fucked up in many ways. So my idea was to give both parties the ability. A woman can choose to have an abortion. She can choose to take birth control. A male cannot choose to have an abortion, but he can control whether his sperm is active or not. And that, I think, is an equal power dynamic where both people have the opportunity to have or not have a child. So even if the male decides that they want to make their sperm active and the female doesn't want a child, she still has the ability to abort. And even if the female ends up wanting to get pregnant, the male can make it so that his sperm doesn't work and it never happens. This is an equal power dynamic in which the male and the female both have an equal power and say in having the child.
So why am I bringing this up? Did you know that right now there are active laws in place preventing insurance companies, conglomerate corporations, and health insurance companies from being held legally liable? I will have links in the description below. And here's some screen caps of some of those things that I'm talking about. And if you've ever been through the system, then you know exactly what I'm talking about already. ADA violations, labor law violations, any violations like this are really, really hard to report. You can report it to your local ADA or your labor department, and there's not much they can do about it other than tell you to go and get a lawyer. Even if you go and get a lawyer, the lawyer will tell you that there are laws in place that make it very, very difficult to hold the companies accountable for things that are already federally documented as being against the law, such as discriminating against somebody who is willing to work just because they have a disability, which is something that I have ran into personally in light of the neurogenic thoracic outlet syndrome. Although there are some laws being put into place to make it so you can now, very recently they've done this, it's still a very real dilemma and only the tip of the iceberg. Right now, doctors and medical professionals are at the mercy of insurance companies, telling them what medications to prescribe, what procedures they can and cannot be done, all the way to telling them they cannot take an MRI, but an X-ray instead. And here's some clips for you, if you don't believe me, of testimonies from doctors themselves.
Stop telling doctors what to do. I enjoy a fairly small private practice and a manageable telepsychiatry side job with good support staff. But even the small scale of my outpatient clinical practice doesn't fully insulate me from the pain of unnecessary practices that I wish would become obsolete. 1. Pre-authorization. The dance of pre-authorization starts with the naivety on my part that I decide what medication my patients should be on. I spend precious time crafting a treatment plan with my patients and send in a prescription. Dear doctor, you are not done. Even in cash private practices, the patient's insurance will make known who wears the pants in this relationship. It's not the physician. Try asking why a medication needs a pre-authorization, and witness an unapologetic deal with it or suck it up buttercup attitude. I always cringe when asked if I have considered sedatives/hypnotics instead of non-addictive sleep medications or other thoughtful, inappropriate due to more adverse effect prone, hence cheaper, medication for treating bipolar depression or anxiety. The fact that my treatment decisions have to be scrutinized by an insurance company, whose goal is to save money rather than helping the patient, makes this interaction as pleasant as witnessing sideline coaching during soccer games by worked-up parents. My wish, if pre-authorization is here to stay, physicians should be allowed to bill the insurance companies for the time we spent on these purely cost-cutting practices. 2. M&M and Skittles. Pharmacies now routinely request 90-day medication supplies or fill 90 days without consulting with a prescribing physician. Seriously, who in their right mind would want to wait and see if a medication would work or not? As a psychiatrist, I have unique challenges of titrating up or tapering off many medications based on my clinical evaluation of the patient. Furthermore, many of the psychiatric medications like lithium, tricyclic antidepressants, and the like can be lethal in accidental or intentional overdoses. There is no way a pharmacy or the insurance company has the slightest idea of a patient's various risk factors, as well as I do, yet they take upon themselves to make the supply decisions for my patients. My wish, insurance companies/pharmacies stop playing doctor or be liable for providing large quantities of pills to patients without physician permission and stop forcing physicians to write high-quantity scripts regardless of safety. 3. Pharmacy blues. I could write a book about this one. In my experience, the big chain pharmacies are the most problematic and worst offenders in this regard. I try hard to deal with local and small pharmacies to avoid big chain and their mail-order cousins, but once again, insurance companies strike. I have lost count of how often my prescriptions are lost or not filled on time, resulting in withdrawals and at times decompensation, and then be blamed for not sending the prescription. Ironically, when I call, since I can see the transmission report on my end, the prescription is found with an appropriate number of refills. But I don't have time to chase my prescriptions. I have gotten requests for refills for medications that I have discontinued and had sent orders to the effect. Complaining to pharmacy supervisors about multiple instances of their staff not checking PMP, and inappropriate controlled substances dispensing has its pitfalls. Additionally, anecdotes of pharmacies refusing to fill scripts because of potential interactions make the issue even more groan-worthy. The attitude that a physician's medication order can be refused, but overenthusiastic reminders for refills are appropriate, is puzzling at best. My wish, please give my fax machine a rest. If you have concerns, don't make treatment decisions for patients by not filling prescriptions but call the physician. We should continue to empower patients to take control of their medications by contacting their physician for refills or medication concerns. 4. Doctor Who? Now I have to undo medical advice given by non-physicians. Even with the best of intentions, these interactions are problematic at best because they directly interfere with treatment decisions made by the patient Dr. Dyad by excluding the physician. Pharmacists, therapists, and psychologists can provide appropriate consultation to patients, without undermining the treating physician. Psychiatry is a complex art. My 4-year residency was grueling, and our fellowships are not irrelevant. It is my training that taught me the art of using an alpha-1 antagonist to combat nightmares and PTSD or an alpha-2 agonist being a valid treatment, especially in children for a variety of psychiatric diagnoses. When already anxious patients are told by others that their psychiatrist shouldn't be prescribing a certain medication, they rightfully freak out, despite prior discussion about the rationale for use. Similar problems occur when well-meaning therapists and psychologists recommend medications to patients. As a result, psychiatrists are spending time retelling patients why they can't be on a benzodiazepine, or why they are on a mood stabilizer. My wish, please give the treating physician the courtesy of a phone call, if you are so inclined to discuss the prescribed treatment. But please, do not practice medicine without a license. Our jobs are inherently and rightfully stressful due to the responsibility we have for patient safety. The burden is, however, increasing because there are multiple chefs in the kitchen without the understanding of the basic ingredient, medical education and training. We continue to carry the highest liability and risk regarding patient outcomes and safety, even when we are forced to practice otherwise. We, as physicians, need to make alliances with our patients to put patient safety and care decisions back in the hands of the patient doctor dyad with appropriate consultation from pharmacist, therapist, case manager, and insurance companies, etc., initiated from within the dyad and not the other way around. Physician-led care needs to be the norm, not the exception. It's high time to stop telling me, "Dear doctor, do this." Najma Hamdani is a psychiatrist. Image credit, Shutterstock.com. November 22, 2019 Kevin. November 23, 2019 Kevin. How do health insurance companies harm patients? Healthcare policy has been a hotly debated political topic for many years now. In recent years, new laws passed the halls of Congress while others failed to gain any traction. Despite the rules that have rolled out, health insurance companies have been in the driver's seat for decades. While spokespersons for the health insurance industry will tell you that they do not make medical decisions. As a doctor, I can tell you that they make medical decisions on my patients every day. They decide what diagnostic tests are allowed and what medications a patient can be prescribed, without speaking to or examining the patient. However, despite the fact that they practice medicine without a license, they are not required to carry any malpractice insurance. Legally, they are protected from all liability by the contracts they hold with healthcare practitioners and patients. How do health insurance companies harm patients? They give patients a false sense of security that they are covered for their healthcare. In truth, more and more plans come with really high deductibles. Often, they will not pay anything in a given calendar year unless a major life-threatening illness or catastrophic medical event occurs. Also, they are free to deny any medical services based on guidelines that they develop, which often come with little transparency. They use prior authorizations to deny needed services/medications. There is nothing scarier for patients than not knowing what is wrong with them. When a doctor and patient decide on a treatment plan and the insurance company denies that service, it delays an accurate diagnosis. Doctors rely on certain diagnostic tools to make definitive diagnoses. What can we do when these tools are taken away from us? What can patients do when their doctor is not allowed to use the tools needed to tell them what is wrong? Their decisions are based entirely on their own guidelines and not evidence-based medicine. Insurance companies require alternate tests. Sometimes, an insurance company will require an alternate study be performed first rather than the one that is actually needed. For example, if I want to order an MRI of the LS spine to detect a herniated disc, certain insurance companies insist I do an X-ray first. Medical science has shown us that X-rays are not a good study for seeing disc herniations. So, in essence, I'm forced to order a test that will not help, that carries additional radiation and delays diagnosis. But, if I don't do it, the insurance companies deny the authorization of the MRI. Whenever an insurance company denies a test, the diagnosis is delayed. Although sometimes this does not pose a risk, there are times it can put patients' lives in danger. I've seen patients waiting months to over a year fighting to get coverage for a test while at the same time worried about what is wrong with them. Also, without knowing the real problem, treatment cannot be started. Patients suffer needlessly waiting to win the game of prior authorizations that their carriers insist they play. Insurance companies decide what medications patients can take. They call it their formulary, which is basically a list of medications they cover. While generics work just as well most times, sometimes they do not cover a single medication in a given class of medication. Also, they tend to change their formulary every year and force people to change their medications if suddenly they find themselves on one that fell out of favor. Some of these patients have been doing well on a given medication for years. I've seen patients suffer complications or flare-ups of their chronic diseases when they are forced to switch. Insurance companies push for early discharge when patients are admitted to the hospital. We all know the ghastly costs of being admitted to the hospital. Insurance companies want patients out as quickly as possible. They determine the number of days they will cover, often just based on an ICD-10 code, and then it is up to the medical team to get the patient discharged before that time is up. Insurance companies also deny procedures. If you have a medical problem that requires surgery or other procedure, insurance companies have to give authorization first. Insurance companies will tell you that the ultimate decision for a medical decision lies between the physician and patient and that they are only making coverage determinations. Doctors are free to order whatever they want and patients are free to pay out of pocket if the insurance denies it. Yet, in this day when a single medication can cost $1,000 a month, is there really any difference for most patients? When a few-day hospitalization can exceed $100,000, who can pay that without help? When patients pay their own insurance premiums, how can they be denied coverage for what they are paying for? Clearly, when we talk about healthcare reform, health insurance companies deserve greater scrutiny. Linda Gerges is a family physician who blogs at Dr. Linda. Image credit, Shutterstock.com. November 7, 2018 Kevin. November 8, 2018 Kevin.
The scary part is you in no way have any legal right to sue insurance companies for dictating to the doctors how they should treat you. These are people who are not medically trained, telling you doctors and ultimately you what treatments are right for you and which aren't. Even scarier still, no one has elected these big corporations into power using our democratic republic system of style of government, which is a bottom-up power dynamic. The corporations are playing a top-down power dynamic, which is a form of dictatorship, feudalism, theocracy. Welcome, everyone, to the age of the This is not an equal power dynamic as illustrated in my outline of classical anarchism. This is not even republic nor democratic, which is a bottom-up power dynamic. It is a top-down power dynamic. There will be more to come on the medication side of things, as there has been much I have seen in medications that do not even make sense. Support the idea of choices and not one's ability to impose one's will on others against their own will. Have a good night.